Thank you very much for the kind introduction, Dr. Darius. Thank you as well for inviting me to speak on this very important topic. I understand that in Khon there are 18 nursing homes. In the area that my hospital works with, I also take care of about 18 nursing homes. The difference is that in my 18 nursing homes, some of my nursing homes can be as many as 8,000 residents inside one building. And I think this reflects a trend that as the population ages, right, there's going to be more and more nursing homes within your community. And I'm very appreciative of the far-sightedness that your organizers have in talking about this topic about doing advanced care planning in aged care facilities. Before I go on, I'd like to declare that I have no financial conflicts of interest. And I would like to answer this question from three perspectives. The first is to really share with you the benefit of doing advanced care planning in aged care facilities. And I will be using Singapore data to show you some of the effects that we have after doing advanced care plan. The second content that I'll be addressing is to really share the differences in doing advanced care planning in aged care facilities compared to the hospital. And lastly, I'm going to talk about some challenges that we faced in advanced care planning, sharing some of my experience from doing advanced care planning in Singapore. Let's address the first topic, which is what's the benefit of doing advanced care planning in aged care facilities. I think Dr. Khon will be talking about this more in the next talk, so I won't be going too much about it. But in general, there are 4 benefits that literature tells us that ACP can do in taking care of somebody at the end of life. First, we reduce the need for unnecessary life-sustaining treatment. You increase the use of hospice and palliative care. You prevent hospitalization and you increase compliance with end-of-life wishes. If you look at the nursing home literature or aged care facility literature, the number of studies are much less, but you see a similar trend, right? Once we do advanced care plannings in the nursing homes, you tend to see a reduction in the people that use hospitals. Interestingly, if you do advanced care planning in nursing homes, at least for a few studies, you do not show that you are increasing mortality. More people will pass away in the nursing home instead of in the hospital. And lastly, we tend to have more patient concordant medical treatment. But this is all literature. This is what has been reported. Let me share with you some of the data that we have in Singapore after doing advanced care planning and palliative care in Singapore. So for those people that remember Dr. Patricia's talk, there are 3 hospital to nursing home services in Singapore, and Project Care, which I run, is the oldest and has been around for about 15 years. So we did an audit in 2019, which is about after 10 years of running the program, and we have done about 2,000 advanced care plans, right, for which we took care of about 2,000 residents, right, and of most of these residents, most of them choose to pass away at nursing home. So remember, we talked about how advanced care plan allows patients to pass away comfortably at nursing home. 75% of our deaths, right, happen in the nursing home, right? We talk about patient concordant care, right, with our program, right? About 80 to 90% of our patients pass away where they choose to based on their advanced care plan. More importantly, you talk about reduced healthcare utilizations, and we can reduce healthcare utilizations by about 75% just by implementing an advanced care plan plus palliative care initiative at the aged care facility. This was actually shown in Dr. Patricia's talk as well, but if you just look across Singapore and you compare the nursing home or the aged care facilities palliative care initiatives compared to the control. So these are nursing homes that do not have PC and ACP advocacy, right? We find that by doing ACPs and doing palliative care, you're able to reduce the amount of times that these individuals use the healthcare system, right? Again, showing real-world benefit, right, of doing advanced care planning and palliative care in aged care facilities. And so the question to ask, right, is how does advanced care planning lead to such good outcomes for our patients? And this is my postulation of why. There are three things that advanced care planning does that helps our patients. First is what I call right side of care. What this means, right, is that patients with end-of-life conditions receive treatment in facilities that are appropriate to their condition. The second, right, is you reduce the need or the use of burdensome treatment that increase harm more than benefit. And lastly, you respect the patient's wishes, especially at the end of life. And the reason why doing advanced care planning is very important in the nursing homes, right, is because there are two realities that residents of aged care facilities face. The first, right, is that there is a high proportion of inappropriate care in aged care facilities, and I will highlight some of them later in my subsequent slides. The second is that there's high healthcare utilization, right, in this group of patients. And one of the observations is that most patients in the nursing homes do not have cancer. And I think this is a contributing factor as to why residents of aged care facilities suffer high proportions of inappropriate care and are high healthcare utilizers. Let me substantiate what I mean. The first is the inappropriate care, right, that patients in aged care facilities face. Let me draw your attention to this study by Dr. Susan Mitchell. So Dr. Susan Mitchell was the author of a very important paper that looks at prognostication of advanced dementia. Prior to that study, in 2009, she did a retrospective study that looked at the end-of-life experiences comparing people who have cancer and people with advanced dementia in the nursing homes. And why is this important? Because a large proportion of residents in aged care facilities actually have late-stage dementia. Let's compare some of the differences in care. If a patient in an aged care facility is going to pass away, they are less likely to have completed an ACP. Not only that, they are more likely to have some form of invasive treatment, either from blood tests or IV antibiotics, or the use of restraints. Compared to cancer patients, however, similarly, more of these patients are going to have fever, pneumonia, and pressure injury. We talk about inappropriate care, right? We also talk about high healthcare utilization. And this is a study that was done in Singapore. Dr. Ellen Hum, who I think some of you are very familiar with, was one of the co-authors in this study. And what the study authors did, right, was they looked at how do people with non-cancer conditions, right, how do they use the healthcare system at the end of life? And what you see, right, is a common, whether or not you have end-stage heart disease, end-stage lung disease, or advanced dementia, within the last 3 months of life, you realize that there is a spike, right, in them using the healthcare system. And this is the bar graph, right, tells you where they spend most of their time. Most of them spend their time in the hospital, right? So these are patients, right, who end up going to a hospital multiple times at the end of life. And the question we need to ask ourselves is this the kind of care that our residents in aged care facilities should have? Another way to look at this is to look at some data in Singapore as well. This is an audit data from 2015, right? And in 2015, there were about 9,000 residents of aged care facilities in Singapore, of which, right, there were about 6,000 to 7,000 admissions. But just look at the admission rate, right? In a nursing home, right, per 1,000 nursing home population, the admission rate in hospitals is about double that of the community dwelling older adult in Singapore. highlighting, right, that our patients in nursing homes are actually really used and spend a lot of time in the hospital. And so what am I trying to get, right, by showing you all this data? One, right, is we advocate for good palliative care, right? I want our patients to pass away in the community, to pass away in comfort. Yet we see a gap. Many patients in our nursing home do not get to fulfill this wish. They spend most of their time in hospital, and we need to find a way to address that. And that's where I think good advanced care planning and palliative care can come into play. So let's talk about conducting advanced care planning in the nursing home setting. What is different, right, between doing an advanced care plan in the aged care facility and between the hospital? The first thing that I think we need to recognize is that patients in aged care facilities have a different disease spectrum compared to that in the hospital. So the graph, the pie chart here actually shows the conditions that are enrolled into my program in Tock Seng Hospital, right? And we take on residents in aged care facilities with either advanced cancer who are not on treatment, who have end-stage organ disease, or have advanced frailty and dementia with recurrent admission. The thing that's very interesting in the aged care facilities is that you realize that a good proportion of your patients actually have frailty and advanced dementia as their end-of-life condition, right? Following which probably cancer and then end-stage organ disease, which may be slightly different from the hospitals where most of our advanced care planning is usually done for patients with cancer, right? And because of the different disease spectrum, the way you conduct your ACP is a little bit different. Because most of us are trained to conduct advanced care planning, maybe with patients with cancer. We need to be able to conduct ACPs for patients with late-stage dementia and frailty, which is a little bit different, because how are we taught to do advanced care planning? The first thing we do, right, is to elicit the patient's preferences and wishes, correct? But for most of our patients with late-stage dementia who cannot communicate and who have no decision-making capacity, how are you going to elicit their values and their wishes, right? And that's a skill that we need to learn when we're doing advanced care plans. So most of the time, we're doing advanced care plans in the nursing home with the patient's loved one, with the patient's family members, right? And we need to be able to identify what they would have wanted. Were they able to make decisions now? Because we are also doing advanced care planning with the next of kin or the caregivers most of the time, sometimes our caregivers may not have the best interests of the patients at heart because they have not seen their loved one for many years, or they do not care about their loved one, which is why they are in an aged care facility. And so sometimes, we have caregivers who are very afraid to make decisions for the patients. There are some caregivers that don't care, right? And sometimes you have caregivers who cannot accept, right, that their loved ones are passing away. One of my struggles of doing advanced care planning for people with dementia is that very few loved ones actually understand that patients can pass away from late-stage dementia. They come to me and say, but memory loss is normal in aging, correct? Right? Or why can't you treat a pneumonia? Pneumonia can be treated, right? But they don't understand that actually people can pass away from dementia. And I think Dr. Anayapon is going to talk about grief tomorrow. But when you do advanced care planning with individuals with dementia, we need to be able to address some of the grief that they also experience during that conversation as well. Secondly, we also need to realize that there is a different perspective of people in aged care facilities compared to some of your patients that you see in the hospital. What do I mean by this? There was a study that was done in Singapore, qualitative study, that looked at the perspective of end-of-life decision-making between nursing home residents, that means people who live in aged care facilities, and healthcare professionals, right? And this study results were very interesting. It showed that actually aged care facility residents, right, actually wanted their doctors and their loved ones to make decisions for them, right? When at the point of time when they reach critical illness, which is very different from how we are taught in advanced care planning, where we always want to hear and elicit the patient's wishes, right? Which is why you see this difference in their opinions, right, when we talk about end-of-life care. Another study that was done, this is a qualitative study that was run by my hospital, right, that looks at the difference, that looks at the opinion of advanced care plan between doctors and nursing home staff versus the residents and the next of kin of the residents of the nursing home. So all the nursing home staff thought that there is low awareness of ACP, that next of kin didn't want to talk about death and dying, that the next of kin were very burdened by decision making. But actually, if you talk to the next of kin of these residents, actually most of them were very ready to talk about advanced care planning. Most of them were even willing to sign on an official document to say that this is their plans. And yet, most of them felt that while I want to help, I want to talk to doctors about death and dying, they feel very inadequate, not able to make decisions, right, for their loved ones. And it just shows that actually that our residents of the nursing homes or aged care facilities really are looking to have these conversations. And lastly is different care capabilities. So this is an example from Singapore. In a restructured hospital or government hospital, right, in Singapore, you are likely to have a nurse taking care of maybe 6 patients, with daily reviews by an attending consultant, with full support by an allied health professional, physiotherapists, occupational therapists, pharmacists, social workers. In aged care facilities, however, a single floor of 40 patients can only have 1 staff nurse taking care of them, right? Sometimes in an entire nursing home, there can only be 1 staff nurse at night. So the 800-bedder nursing home that I'm managing also has only 2 staff nurses to take care of 800 residents at night. Sometimes you have a locum general practitioner, don't even have a regular physician to take care of these patients. And most of the allied health is usually support services. And because of this, one of the challenges is to ask ourselves, do the nursing homes have enough staff to even do advanced care planning, right? And this is one challenge that we realize also. And lastly, the residents of your nursing homes have a different social demographic. I use this to teach people about geriatric medicine, and I always say that in geriatric medicine, there are 3 core principles. The first core principle is comprehensive geriatric assessment. The second core principle is person-centered care. And the last core principle is aging in place. It's a desire for most geriatric medicine doctors for older persons to age healthily in the community, right? And only when they are too frail do they end up going into an aged care facility. So if you think about it, what allows an older adult to age in place? You need 2 things, or at least one of 2 things. You need robust social support. And number 2, you need robust physical health. What I mean is this: if a person has robust physical health but has poor social support, they can still be in the community, correct? They may be poor, but they are still aging in the community, right? If they have poor physical health but good social support, a lot of money, correct? They will be at home with many caregivers, in a nice air-conditioned room, and they do not go to aged care facilities. Only if you have no social support and you have poor physical health do you go into an aged care facility, at least in Singapore. Which means that the people, at least that go to aged care facilities, are a different group of people. The first group, right, are those individuals who society rejects. So in Singapore, if you are a resident of an aged care facility, you either have drug abuse before, or you are homeless, or you have a chronic mental illness and nobody in society wants to care for you, so you go to an aged care facility, right? The second is those that are poor. I understand that it's a little bit different in Thailand. In Singapore, aged care facilities are subsidized by the government. So if you are very poor in Singapore, you get to go to an aged care facility. Okay? And because these people are financially very poor, the kind of medical treatment that they get, right, is going to be limited because they don't have the money to pay. Last, right, is those people that the family doesn't care about. That means there are people who are physically very frail, but the family members don't want to care for them. And so they end up going to aged care facilities. And this actually means that the kind of ACPs that you do, right, will have a unique flavor. And let me just share two stories with you, right? So this is a unique ACP that I've done recently. This gentleman was referred to me because he told the nursing home staff, I don't want to go to hospital. I don't want to see my doctor anymore. Let me die comfortably in the nursing home. So I went down to do this ACP with him, and as I was talking to him, he was sharing with me his story. He was saying that he used to like to play football, but then he has cervical myelopathy, and then he fell, so he had some cord syndrome, and he went for an operation. But despite the operation to try to restore his walking ability, he was rendered chair-bound, and because of that, he needed more care. So after that, right, he lived, and then he and his wife didn't have a very good relationship, so his wife kicked him out of the house, right? And what happened after that was, so he ended up staying with his son. But after a while, his son had children, and his house had no space. So he told the patient, you stay in the nursing home. Correct? And he actually got kicked out of the nursing home. And because of that, he was so depressed, he was so sad, right? He actually had stage 5 chronic kidney disease. He didn't want dialysis, and he was saying that, I'd rather die, don't bring me to hospital, my family members don't care about me, and you can see that these are individuals who really, he was really very sad, right? But these are some of the patients that we see, people who are abandoned by their family members, right? And these are the kind of people who can have struggles, right, with the end of life condition. On the flip side, correct, I had a patient who used to be who was not a very good person when he was younger, right? So he used to gamble, he used to be involved in alcohol, and he didn't take care of his family members. So he suffered a stroke and he went to a nursing home, and the family members wanted to do an ACP. And the family members said, why can't we just let him die? Just don't send him to hospital, right? And these are some of the struggles that our patients have, right, when they come to the nursing home because of the social issues that they have. And what's the point that I'm trying to get at by sharing all this information? I want to just share that the residents of your aged care facilities, right, they will have a different experience, right? They are not the same kind of experiences of people who live who are in the hospital. Because of this, when you do ACPs, right, the way you conduct them will be different. And we need facilitators who are not just aware of the problems that the residents have, but are also proficient in having these challenging advanced care planning conversations with these individuals, right? And as doctors or nurses who do advanced care plan, it's something that we need to think about and a skill that we must learn to develop. I'm going to my last bit of the talk, right? And I'm going to talk about some of the challenges of advanced care planning implementation in aged care facilities, and I'm going to talk about some lessons from Singapore. So if you look at literature, the most recent systematic review, right, talked about a few preconditions, right, for successful ACP programs. And here are a few of them. One, right, is what we call knowledge and skill. So to be able to develop or do ACPs in aged care facilities, we need to be able to increase the knowledge and skills of the people who are running your nursing homes, right? Number 2 is a willingness and ability to participate in ACP. And this has to do with residents and family members, right, who know about ACP and want to have this discussion. right? The third domain is a good relationship. That means a good relationship between the staff members, right, and the residents, right? Because if the relationship is not good, you're not going to have very meaningful ACP discussions. Fourth is to have an administrative system for documentation of the ACP, right? And lastly, right, is to have the appropriate contextual features. This includes resources, an end-of-life palliative care system to allow your ACP program to succeed. With this in mind, I am going to talk about 3 challenges that at least we had in Singapore to overcome in order for us to be able to conduct a good ACP program in nursing homes. First is education and skill sets, right? We need to ask ourselves, if we're going to do advanced care planning in the nursing homes or aged care facilities, who is the one that is going to do it? At least in the traditional model in the hospitals, usually it's going to be a doctor or a primary care provider that is doing the advanced care plan, right? If not a doctor or primary care provider, then a specialist nurse, or in certain cases, for example, in chronic kidney disease, which I know is a very strong program here in Kaen University Hospital as well, social workers can sometimes have this conversation, okay? However, in your nursing home, remember I talked to you about the different care capabilities and staffing. My experience in Singapore is that most of the time, nurses or social workers are going to do the advanced care planning for the residents. And this creates a problem because there is a difference in the knowledge expertise between a doctor and a nurse, or between a doctor and a medical social worker, right? And in order for your advanced care planning program to succeed in a nursing home, we need to be able to overcome these knowledge deficits. And the way to do it is by education. So there are a few education models that have been implemented. This is one of them. So in my hospital, what we do, right, is we go to nursing homes to train nursing home staff and nurses on how to conduct advanced care planning. So what we do is that we go down to set up workflows, we conduct training and mentorship programs, and we set up publicity materials in the nursing home to educate the residents and their next of kin about advanced care planning and the services. So over 2 years, we conducted about 30 training sessions with about 87 facilitators. And these are some of the results that we have seen, right? So amongst all the people that were recruited into this study, right, most of them are actually nurses, right? And you can see that after a training program, after 3 months, we find that people are more proficient, right, in conducting goals of care discussion and ACP, and more of them are willing to complete ACPs, right? And more of them, and you look at the last point, more of them feel, after training and educating, more of my nursing home staff say that actually we should have ACP as part of the routine care of our residents. We see that their confidence increases, right? And not just that, one thing that I want to highlight, right, is if you're going to do education on advanced care planning, mentorship is very important. So you can't just train somebody and say, go and do ACPs on your own immediately after the training. We need to create a system of mentorship where trained doctors and trained facilitators can sit next to the trainee and give them feedback on what they did right and what they did wrong, right? And what they can do better. And you see that actually once you do mentorship, right, the ability and the quality of the advanced care plans in the aged care facilities go up by quite a huge margin. Another thing that we can do is to integrate advanced care planning into your nursing home training syllabus. So this is taken from the website of Gericare. Dr. Patricia talked about Gericare already in a previous talk, right? So Project Care takes care of the central part of Singapore, Gericare takes care of the north. And in the training that they do, right, you see how advanced care planning, right, is part of the mandated training that all the nursing home staff have to attend, right, under their program. And because of that, you create a culture where people are willing to do ACPs and not just train them. What we did also was we got the the training program in nursing homes to be a certification that they can complete. Right, and here this is a photo of the 2019 graduation ceremony that happened just before COVID. Right, you can see that once you educate and you do certification, right, more and more people are willing to learn and to participate, and this allows the nursing homes to be able to conduct advanced care plannings independently without the hospital going down to do it for them. And so what I want to share is that if you're going to do or start advanced care plannings in aged care facilities, I would advise that your education programs are your number one priority, right? And this is something that must start first. But it's a long-term investment. When you start educating people, you're not going to see results within the first 1 to 2 years. Maybe 3 to 4, 5 years later, then you will see the benefit, right, of such education program. But it's a long-term investment because you improve the quality of advanced care plan that's done in a nursing home. The next challenge is the organizational and institutional support for advanced care planning in aged care facilities. If you think of yourself as the manager of an aged care facility, right, why would you want to do advanced care plan, right? I already have no money, I have no staff, the government doesn't support me, right? Why do I want to do advanced care planning, correct? I have no money, I have no staff. Then most of the nursing home leadership will tell you people who are dying should not be cared for in the nursing home. They should all go to the hospital, right, to receive palliative care. Correct? That is exactly what some of our nursing home leaders have fed back to us. And so, in order to change this mindset, we have to create an ecosystem, right, where the advanced care plan is respected and is important. And so one thing that Singapore has done very well is that we have created an advanced care plan office or HQ in the Agency of Integrated Care. And what this office does, right, is that it does training, but more importantly, it created the IT system to record all your ACPs, correct? It does quality improvement, so it tracks your nursing home advanced care plan quality, correct? And it does the engagement for you also. And because of this, with a central organization advocating for ACPs, right, we find that the uptake for ACPs become a little bit more, at least in the Singapore setting. More importantly, you must create the electronic healthcare system, right, to document the ACP. So one of the biggest problems, at least in Singapore when we first started out, is that we can do the advanced care plan, but because the nursing home uses a different IT system, all the documentation that we have done is not reflected in the hospital database. So when they go to hospital, they end up getting CPR and ICU, right? And so one thing that we had to do is to help to create a system whereby the advanced care plan that was done in the nursing home gets transferred, right, to the national healthcare database so that the effort that is put in actually leads to patients' wishes being respected. Thirdly is funding. So one thing that I think Dr. Patricia also talked about this, but this is new. In this time, at least from this year onwards, if a nursing home or a primary care doctor does an advanced care plan, some money will go to them instead of to the hospital. So it makes the nursing home directors, the nursing home doctors more incentivized to do advanced care plan because they get money, okay? But apart from money, right, in terms of nursing home licensing, in 2020, the government mandated that all nursing homes have to screen their patients for advanced care plans and do ACPs, right? And in order to maintain their nursing home license, they have to demonstrate this. So this is some things that we can do to ensure that the system is put in place. So I would like to just share that apart from the doing the ACP in the aged care facilities, right, we need to take a bit of a meso or a macro perspective to think about how we can build in the advanced care plan, right, as part of routine care of your residents in our aged care facilities. And to do this, I think we need to make changes at the level of the healthcare system, right? And for those members of the audience who sit in influential decision-making positions, right? This is something that we can think about how we can make changes at the macro or the meso level. Lastly is we need an ecosystem to respect the ACP. And what I mean by this, this is a study in Singapore. Even with doing advanced care planning in nursing homes, not all the advanced care plans or the decisions on the advanced care plans are respected, right? And one of the reasons is this. If you can do an advanced care plan for a resident in the nursing home, right, to choose to be comfortable and to remain in nursing home, to die in nursing home, but when the resident runs into crisis, there is no palliative care support for that patient in the nursing home, the nursing home resident is going to end up in the hospital. And so we need to create a model of care such that the nursing homes can respect the ACPs, right, that is done by the residents. So this is where the models of care come in. I'm going to tie some of it back to Dr. Patricia's talk earlier, right? But this is my program, Project Care. So this is my hospital here, right? And these are the many nursing homes that we reach out to, right? And you can see we have about 5,000 beds, right? What we do is that we run palliative care services. So if the nursing home resident chooses to pass away and die in the nursing home, we go out to the nursing home and we provide palliative care for them so that their wishes can be respected. So this is one ecosystem that can be created. Another ecosystem that you can create is to use, if sending a doctor and a nurse to a nursing home is too time consuming and too expensive, one thing that COVID has taught us is that telehealth is a very useful tool. So this is what GeriCare does in the north of Singapore, right? For people who are unwell, they get electronic telehealth consultations, right, with doctors in the hospital to help them manage their end-of-life symptoms so that they can pass away comfortably in the nursing home. And we can leverage on technology, right, to do this for us. And so my last take-home message I want to share is that apart from doing ACP, in tandem, right, we need to create an ecosystem that can deliver end-of-life care so that ACPs can be respected. And this must come together, right? You can't do one without the other, right? And I would encourage those individuals that are thinking about making a difference in the nursing home or the aged care facility space to think about this. I'm going to conclude with just this simple sharing, right? That culture is more important than structure. What I mean is this: you can create a lot of programs, correct? But if the resident or your nursing home leadership does not believe in what you're doing, nothing will happen, right? And I think it's very important as we advocate for patients with advanced care plans to really think about changing culture, changing mindset, right? So that we are able to deliver better end-of-life care for our residents of nursing homes. I would like to end my talk here, and I would just like to show appreciation for a few individuals that helped me prepare for this, Dr. Raymond Ng and Mr. Roland Chong for giving me some material, as well as my team of doctors and nurses who have always given their time and their effort to take care of these residents in aged care facilities. Thank you.